So we're going to talk about the shoulder joint intra-articular injection posterior approach. There's also an anterior approach. We were talking to talk about the skeletal anatomy for the posterior approach for the shoulder joint intra-articular injection. The bony ciliates that you will see on the ultrasound will be the glenoid process, the glenoid labrum, and the articular surface of the humerus. The way to perform this injection, you'll feel for the spine of the scapula and you will place your ultrasound probe just below the spine of the scapula, and you'll be looking for this bony ciliate of the glenoid process and the articular process of the humerus. Now, how to perform this injection under ultrasound guidance? You can perform either it as an out of plane. My recommended technique would be to go in plane from lateral to medial, trying to get into the joint. Tips here, avoid touching the labrum. You will also see the soft tissues. The muscles would be the infraspinatus muscle along with its tendon, the articular cartilage of the humeral over the top of the humeral head, and the glenoid labrum that's attached to the glenoid process. So to perform the intra-articular shoulder joint injection, the patient position will be the supine. If the patient can touch the contralateral shoulder, it will allow the joint to open up, but majority patients with shoulder pain might not be able to do that. Next step would be is to palpate. So palpate the spine of the scapula, and then you will be positioning your probe under the spine of the scapula. Once you position the probe under the spine of the scapula, you will be able to perform this injection either an out of plane technique or an in plane technique coming from lateral to medial. Here I'm going to show you all the structures that are relevant to the intra-articular injection of shoulder joint posterior approach. You have humeral head, the articular cartilage, glenoid labrum, glenoid process, and the whole of this muscle is the infraspinatus muscle along with the infraspinatus tendon. The needling will be lateral to medial coming and basically touching and intra-articularly spreading the local anesthetic and steroid medially.